Talks. I am a registered nurse, and in this live stream, we will be talking about various health topics related to heart, diabetes, arthritis, kidney stones. I will be giving out solutions to your most commonly frequently asked questions. So let's start. And first of all, I want to say that this video is not a medical advice to you. You have to always concern your own personal doctor for your health. And this is, let's start with the stream. So first question is, can I reverse type 2 diabetes just by walking? So I would say that walking is a mechanical insulin. When you walk, especially after a meal, your muscles contract and activate a protein called GLUT4. This protein allows glucose to enter your cells without needing insulin. For many, a 15-minute brisk walk after a dinner can drop your blood sugar by 35 to 40 points. Over years, this glucose clearing can help achieve A1C remission, but it must be paired with a reduction in refined carbohydrates to stop the spikes at the source. So I hope that helps your question, and we would move on to another one. Is fruit sugar just as bad as table sugar? So I would say that no, because of the fiber matrix. When you eat a whole orange, the fiber slows the digestion of the fructose, giving your liver time to process it. When you drink orange juice, the fiber is gone and the fructose hits your liver like a freight train, contributing to fatty liver disease. Stick to berries and kiwi, they have the highest fiber to sugar ratio. Let's move on to another question. Why is my blood sugar high in the morning when I didn't eat all night? So I would say this is the dawn phenomenon. Around 4 a.m. to 8 a.m. your body releases a wake-up cocktail of cortisol, adrenaline and growth hormone. These hormones tell your liver to dump stored glucose, which is glycogen, into your blood to give you energy for the day. In diabetics, the body can't handle this surge, leading to high fasting numbers. The solution: a small high protein snack before bed or improving sleep hygiene to lower cortisol. So I hope that helps. Let's move on to another question. Is berberine really nature's metformin? So I would say that berberine activates an enzyme called AMPK, which is often called the metabolic master switch. The switch improves insulin sensitivity and helps liver produce less glucose. However, it isn't a magic pill. You need a high quality dehydroberberine version of better absorption, and it should be taken 30 minutes before a carb heavy meal. Okay, so I hope that helps. Another question is, does apple cider vinegar actually help with insulin spikes? So I would say yes. The acetic acid in ACV slows down the conversion of complex starches into sugar. If you drink 1 tablespoon of ACV in a tall glass of water before a meal, it can reduce the post-meal glucose spike by up to 30%. And I would give a pro tip: use a straw to protect your tooth enamel. So I hope that helps. So let's move on to kidney stones. So we have another question. If kidney stones are made of calcium, should I stop eating dairy? I would repeat that question. If kidney stones are made of calcium, should I stop eating dairy? So I would say this is the most dangerous myth. Most stones are calcium oxalate. Oxalate is found in plants such as spinach, nuts, beets. When you eat calcium with oxalate rich foods, they bind together in the stomach and leave through your stool. If you stop eating calcium, the oxalate travels to your kidneys alone, where it binds with calcium in your urine to form stones. So, the fix for this is always pair your spinach with cheese or yogurt. I hope that helps. And let's move on to another question. Is lemon water actually a cure for kidney stones? So I would say it is a powerful preventative. Lemons are high in citrate, which does two things. It binds with the calcium in the urine to prevent stones from starting, and it coats existing small stones so they don't grow larger. You need about 1.5 cup of pure lemon juice per day diluted in water to get the therapeutic effect. So another question is, why do I keep getting stones even though I drink water? So I would say that it might be your sodium or sugar intake. High salt causes your kidney to dump more calcium into your urine. High sugar increases uric acid and calcium levels. Even if you drink 3 liters of water, a high salt, a high sugar diet creates a super saturated environment where stones grow regardless of hydration. So let's move on to another question. Does Chanka Pidra, the stone breaker, actually work? So I would say this herb has been used in traditional medicine for centuries. Modern studies suggest it doesn't crush the stone into dust, but it relaxes the ureter, the tube the stone passes through, and interferes with the clumping of crystals. It's best used as a preventative or during the very early stages of a small stone pass. So I hope that answers your question. Let's move on to another one. Is the roller coaster trick real for passing stones? So I would say, believe it or not, yes. Research showed that the vibrations and g forces of a moderate roller coaster can help dislodge small stones from the kidney's lower chambers, allowing them to enter the ureter. However, don't try this if you are in active agonizing pain. Go to the ER. So let's move on to another question. So, what does a stinging sensation in the chest mean? I would say usually a sharp localized stinging that changes when you breathe or move is costochondritis, inflammation of the rib cartilage or reflux. True heart pain, angina, feels like an elephant sitting on the chest or a dull crushing pressure that radiates to the neck or left arm. However, self-diagnosed chest pain, get an EKG. Let's move on to another question. Can heart age be lower than my actual age? So I would say that yes, your biological age is determined by arterial stiffness and inflammation. If you have high HDL, low triglycerides, and a healthy BP, your arthritis your arteries might function like a 30-year-old even if you are 50. You can measure this via pulse wave velocity test. So I hope that helps. Let's move on to another question. Is red wine actually good for the heart, or is that a myth? So I would say that it's mostly a myth. The amount of resveratrol in a glass of wine is too small to provide a therapeutic effect. The alcohol itself is a toxin that can increase the risk of AFib, irregular heartbeat. Any benefit usually comes from the social relaxation or the Mediterranean diet that usually accompanies wine. Let's move on to another question. What is a broken heart syndrome? I would say that formerly known as Takotsubo cardiomyopathy. It happens after severe emotional stress. A massive surge of adrenaline stuns the heart's left ventricle, causing it to balloon out. It looks exactly like a heart attack on an EKG, but the arteries are actually clear. It can be fatal, but it is usually reversible with rest. Let's move on to another question. Why is my good cholesterol sometimes bad? So I would say we used to think the higher the better. Now we know that if HDL is too high, over 100 mg/dl, it can actually be dysfunctional and pro-inflammatory. The most important number is your triglyceride to HDL ratio. It should be under 2.0. If it's higher, you are likely insulin resistance, which is the real driver of heart disease. So another question is, can I live with 50% kidney function? So I would say that yes, kidneys are incredibly resilient. You usually don't feel sick until function drops below 15 to 20%, stage 4 or 5. However, at 50%, stage 3, you must be hyper vigilant about blood pressure. High BP acts like a power washer, hitting a delicate screen. It sheds the kidneys filters over time. Let's move on to another one. Does protein powder damage the kidneys? So I would say for healthy kidneys, no. But if you have existing kidney disease, high protein intake creates more urea waste, which the kidneys have to work harder to filter. If you are an athlete with healthy kidneys, just stay hydrated. Sorry for that. So another question is, why does my back hurt when I'm dehydrated? So I would say that your kidneys sit in a lower back the kidneys sit in your lower back. When you are severely dehydrated, the kidneys can struggle to process toxins, causing dull aching. More importantly, dehydration can lead to a sludge in the gallbladder or kidneys, which causes referred pain to the back muscles. Let's move on to another question. Are kidney cleanses or juice fast safe? So I would say most juice fast are high in oxalate, which can actually acute kidney injury. Your kidneys cleanse themselves every time you drink water. The best cleanse is simply 2-3 liters of water and a low sodium diet. Let's move on to another question. How does sleep apnea destroy the heart and kidneys? I would say that when you stop breathing at night, your oxygen level drops. Your brain panics and sends a massive surge of adrenaline to wake you up. This causes your blood pressure to skyrocket while you sleep. Doing this 30 times an hour every night scars the heart and burns out the kidney. So let's move on to another topic of this live stream. So, what if I told you that you have a second insulin system hidden in your legs? Most people believe that the only way to get sugar out of the blood is through the hormone insulin, but there is a backdoor inside your muscle cells is a glucose transporter protein called GLUT4. In a sedentary person, GLUT4 stays deep inside the cell. However, when you contract your muscles, specifically during a 15-minute brisk walk, your body triggers these GLUT4 transporters to migrate to the surface of the cell membrane. They act like a mechanical sponges, grabbing glucose directly from the bloodstream to use as a fuel without needing extra insulin. For someone with insulin resistance, this bypasses the problem entirely. By walking immediately after your largest meal, you prevent the glucose spikes before it even starts, protecting your arteries from the sticky damage of high sugar. So I would say let's move on to the dawn phenomenon and like why your liver is gaslighting you at 6 a.m. Okay, so why is your blood sugar 130 when you haven't eaten for 10 hours? Your liver is dumping sugar while you sleep. So the solution for this is incredibly frustrating for diabetics. You wake up, check your monitor, and the number is higher than when you went to bed. This is called the dawn phenomenon. Between 4 a.m. and 8 a.m., your brain signals the adrenal glands to release a surge of hormones: cortisol, adrenaline, and growth hormone. These are designed to prepare you for the day. They signal the liver to perform glycogenesis, breaking down stored sugar, and glyconeogenesis, creating new sugar from fats and proteins. So the fix for this is, in a healthy person, insulin rises to meet the surge. In a diabetic, the insulin is either missing or ignored. To fix this, you must focus on lowering stress-induced glucose, improving your deep sleep, and avoiding late night snacks that spike insulin before bed and can help reset the liver's morning alarm. Most people stop eating dairy when they get a kidney stone. This is the biggest mistake you can make. 80% of kidney stones are made of calcium oxalate naturally. People think too much calcium cause the stone, so I'll stop eating the cheese and milk. This is dangerous. Here is the chemistry. Oxalate is a toxic byproduct found in healthy plants like spinach, almonds, and rhubarb. If you eat these plants alone, the oxalate is absorbed into your bloodstream, travels to your kidneys, and finds the calcium in your urine. They bind there, forming a crystal, the stone. And I will also give you the fix for this. If you eat calcium, at the same time as your high oxalate spinach, the calcium and oxalate binds together in your stomach intestine instead. Because that bound molecule is too large to enter the bloodstream, it simply leaves your body through your stool. You effectively trap the stone in your gut before it even reaches your kidney. There is a 10-cent solution in your fridge that stops kidney stones from growing. Lemon juice. So I would say that kidney stones grow like rock candy. They need a seed crystal to start. Your urine contains a natural protector called citrate. Citrate does two things. First, it binds to calcium in the urine more effectively than oxalate does, creating calcium citrate, which is soluble and won't turn into stone. Second, it coats any existing tiny crystals, making them slippery so other crystals can't stick to them and make the stone bigger. So the fix for this is many people don't have enough citrate in their urine. By drinking 4 to 5 ounces of fresh lemon juice diluted in water throughout the day, you significantly increase your urinary citrate levels. This alkalizes the urine environment, making it chemically impossible for uric acid and oxalate stones to thrive. You can pass a treadmill stress test today and have a massive heart attack tomorrow. Here's why. A traditional stress test only detects blockage that are 70% or greater, the ones that restrict blood flow during exercise, but most heart attacks are caused by soft plaque in the LAD, left anterior descending artery. This plaque might only be a 30% blockage, so it doesn't show up on stress tests because blood still flow past it easily. However, this soft plaque is unstable. If you have a spike in pressure or inflammation, the cap on that plaque can rupture like a pimple. Your body sees this rupture as an injury and sends a massive clot to fix it. That clot instantly turns a 30% blockage into a 100% blockage. So the fix for this is the widowmaker. To see this before it ruptures, you need a CT calcium score or a CCTA, which is CT coronary angiogram. This imaging test look through the artery wall to see the hidden gunk that stress test misses. A steady, perfect heartbeat is actually a sign of a weak heart. You want your heart to be chaotic. So people assume a heart should be beat like a metronome, thumb, thumb, thumb. But a healthy heart is controlled by two competing systems like sympathetic fight or flight and the parasympathetic rest and digest. HRV measures the tiny millisecond differences between each beat. If the timing between your beat is exactly the same, it means your nervous system is stuck in stress mode. If the timing varies, sometimes zero point 0.8 seconds, sometimes 1.2 seconds, it shows your heart is resilient and responsive to your environment. So the fix for this is low HRV is a viral health marker because it predicts heart diseases, depression and even death years in advance. You can improve it through zone 2 cardio and deep breathing exercises that tone the vagus nerve. So thanks for watching, guys. I hope you like this live stream, and we would continue with another episode. Bye.